Hey, this is Amy, and today we're going to talk about fluids. So if you would, please like and subscribe to our channel. That would help us out a great deal. So today's topic is fluids. This is going to be short and sweet. Fluids are critical. And of course, we all know that our bodies are primarily water, and the animals in your care, their bodies will be primarily water as well, especially the little babies. So getting them rehydrated is very, very important. Most babies that you receive into your wildlife center are going to be dehydrated. Mainly, it's just figuring out what level of dehydration they're at. And so the most critical thing you can do, one of the most critical things you can do, to help save their life is to get fluids into them. And so we have oral fluids and we have subcutaneous fluids. So two good oral fluids are Gatorade and Pedialyte. Pedialyte is probably a little bit better of the two. It's a little bit more formulated, has the electrolytes, and you can also get the unflavored, which is good. And Gatorade is great in a snap. Or any of the sports drinks, really. And quite honestly, sometimes, I'll cut the Gatorade with some Pedialyte, but that little bit of that kind of sugary taste, sometimes that helps with getting babies to drink it when you're trying to get them to drink it from a bottle. So these two things you can easily give with, a nipple and a syringe and get that into their digestive system. When you're putting things into the stomach cavity, they get absorbed really quickly. But the key is there's a limit to how much, you can push into that digestive tract at any given time. So you do need to take that into consideration, the weight, the size of your animal, to how many. You can also do oral fluids and sub-Q fluids on the same animal. And sometimes you might want to do that if they're severely dehydrated, but they're being cooperative and, are willing to suck on a nipple or have fluids administered orally. So you can get those fluids in fast and then put in some ringers subcutaneously, and, that will be slower acting, but keep getting fluids into that body. Sometimes it can be tricky to do subcutaneous fluids. I've had babies come in just so dehydrated, it's very hard. When you want to put something under the skin, you kind of tent up their skin a little bit and slide that needle right in. And that can be hard if their skin is so, tight and they're underweight and they're very dehydrated. But very, very important getting, fluids into your baby immediately. So I will have a link to a blog article on this with some more information.